palpate the trochlear groove, first we will find the medial joint line and the lateral joint line. This is the medial joint line and this is the lateral joint line. Go upward, we will find the lateral femoral condyle and the medial femoral condyle. Go between them, you will find a depression and this is the trochlear groove. Distally, you will find a large sesamoid bone and that is the patella. Ask the patient to extend her knee. It is more palpable. The patella is more palpable. Yeah. You can medially palpate it and laterally.
Epicondyles of the femur. So first, the knee will be flexed more than 90 degrees and the condyles first will be palpated. So if you go more at the medial condyle, if you go more medially and superiorly, it's the medial epicondyle of the femur. And then at the lateral side, more lateral and superior is the lateral epicondyle of the femur. So now, papalpate naman natin is yung lateral tibial plateau. So from the patella, going lateral and inferior, you will feel a depression. After this depression is a bony prominence. That is the lateral tibial plateau.
Pudakan ka rin.
Palpate the bony prominences, the lateral and medial condyle of femur. First, palpate the patella. Here's the patella. Then, for medial femoral condyle, go medially. Above the depression, you will feel this bony landmark. This is the femoral condyle. Medial femoral condyle. Then, back to the patella. Go lateral. Above the depression is the lateral femoral condyle. These condyles will be more palpable if the patient's knee is flexed more than 90 degrees. So here's the medial and lateral femoral condyles. So now, papalpate naman natin is yung lateral tibial plateau. So from the patella, going lateral and inferior, you will feel a depression. After this depression is a bony prominence. That is the lateral tibial plateau. Palpate tibial tuberosity or tibial tubercle. Palpate the patella. Then after the patella, go more inferior. You will feel soft tissues. Then more inferior, you will feel a bony prominence. This is the tibial tubercle or tibial tuberosity. To confirm it, bend the patient's knee so that it will become more palpable. So this is the tibial tuberosity or tibial tubercle. We will palpate rest of the tibia or the shield. First, palpate the tibial tuberosity or tubercle. Here it is. Then, go downward. You will feel the long bony prominence here. is the crest of the tibia or the shin. It will become more palpable when you bend the patient's knee. Vastus intermedius. The position of the patient is in supine. Then ask the patient to lift her leg, then resist the motion. So, ma'am, kindly please lift your leg. Then don't let me push it down. 1, 2, 3, go. So, the first contracting muscle is the rectus femoris muscle. Underneath this is the vastus intermedius muscle. And gastrocnemius and hamstring muscles. The position of the patient is in prone. Then ask the patient to bend his or her knee. Then resist the motion. So, ma'am, please bend your knee. Don't let me push it down. 1, 2, 3, go. So, this is the gastrocnemius, the contracting muscle, and this is the hamstring muscle.
Infrapatellar tendon. First, you must find the infrapatellar tendon, which is just inferior to the patella. So, here. The bursa, superficial to that, it lies between your infrapatellar tendon and your skin will be your superficial infrapatellar bursa. And, your prepatellar bursa lies between your patella and your skin. It is prominent and the knees are extended, so the skin, it can be here. It is between the skin and your patella, your prepatellar bursa. Lateral meniscus, ask the patient to slightly flex the knee, then this is the joint line. You will find here a plateau. This is the lateral tibial plateau. Then, if you palpate it firmly, this is the lateral meniscus. Palpate the medial meniscus. The knee is flexed, then anterior upper margin of the medial meniscus. Ask the patient to internally rotate the tibia. There. You will find the edge of the medial, this. So, firmly tender mass of the medial meniscus. The two muscles that is part of the pes anseralis, the sartorius and gracilis. I will ask the patient to do knee flexion, then I will resist the movement. Cup your fingers around his knee to the medial side, then feel the tightness of the tendon here. The inferior and posterior here is the semitendinosus. Then medial and anterior is the gracilis. Then go anteriorly and medial is the sartorius. Lateral ligament. First, find the medial joint line. This is the medial joint line. Go medially and posteriorly. Your fingertips will palpate the medial collateral ligament. Ask the patient to cross her leg like this, Then, from the joint line here, go laterally and posteriorly. You will find here the lateral collateral ligament. The prominent ligament here. Here aspect of the knee, popliteal fossa can be palpated. So, from its boundaries, the biceps femoris, semimembranosus, semitendinosus, and the gastrocnemius head. So this is the popliteal fossa. It will be
It can be palpated if the knee is flexed. Now palpate the iliotibial band. So the iliotibial band can be palpated at the lateral aspect of the knee, and to palpate it, the knee must be extended and hip flexion is resistant. So sir, kindly straighten your knee, and I raise your leg to the left side. 1, 2, 3. So it inserts at the lateral tibial tuberosity. Tibial tuberosity. So it can be palpated at the lateral side of the knee. So from the infrapatellar tendon, just go laterally to the lateral tibial plateau, and just below it is the lateral tibial tubercle. The fibula, first the position of the patient is in supine, then from the locate the tibial tuberosity, then lateral to this is the head of fibula. So here, from tibial tuberosity to this. So to become more palpable, ask the patient to bend his knee. So sir, please bend your knee. So here's the head of fibula.
Palpate the infrapatellar ligament. Need to ask the patient to do a sitting position. Then, first we define the patella. This is the patella of the patient. And inferior to the patella, you will feel a tendon or something that's like, squishy over here. That's the infrapatellar tendon. Dr. Tubercle, we need to first find the medial epicondyle of the femur of the patient. But first, make her go into a sitting position. Now that she's in that position, you can locate the medial epicondyle of the femur here, just medially to the patella. Just follow it over here. You'll feel bony prominence. And posterior to the medial epicondyle of the femur is the adductor tubercle. It's the bony prominence over here. Behind, this is the medial epicondyle, and this over here is the adductor tubercle. To palpate the biceps femoris muscle. To palpate that, you need to ask your patient to do a prone position in the bed. After that, we request your patient to flex her leg. Please flex her leg. Apply resistance towards it. And as you can see, this tendon over here, this is the tendon of the biceps femoris. Okay, next.
Palpating the anterior superior tibiofibular joint. First, you must find the head of fibula and go medial. There will be a depression. It will be your anterior superior tibiofibular joint, because since it is between the lateral aspect of your tibia, lateral superior aspect of your tibia, and your medial superior aspect of fibula.